Have you ever wondered what it looks like when the past refuses to stay in the past and instead infiltrates the present? Today, we delve into the world of complex post-traumatic stress disorder, or CPTSD, a mental health condition that does just that. CPTSD emerges from the ashes of prolonged, repeated trauma, often experienced during crucial developmental years. It's not just one traumatic event that triggers it, but a series of distressing experiences, often in an environment where the person feels trapped or powerless. This can include instances of childhood neglect, chronic domestic violence, or long-term exploitation. Much like its cousin PTSD, complex post-traumatic stress disorder carries the burden of reliving traumatic experiences. However, it's not just flashbacks or nightmares. It's a more pervasive, debilitating condition that affects a person's sense of self, their relationship with others, and their view of the world. Those with CPTSD often struggle with emotional regulation, swinging from feelings of intense anger to profound sadness. They may have a distorted self-perception, filled with shame or guilt. They can experience difficulties in relationships, marked by a deep mistrust of others or a constant need for validation. And they may feel detached from the world around them, as if they are forever living in a dream, or rather, a nightmare. Identifying CPTSD can be challenging, as it often coexists with other mental health conditions like anxiety, depression, or substance use disorders, but understanding the symptoms is the first step towards healing. Fortunately, treatment for CPTSD exists. Trauma-focused psychotherapies, such as eye movement desensitization and reprocessing, EMDR, or cognitive processing therapy, CPT, can help individuals process their traumatic experiences in a safe environment. Mindfulness techniques can assist in managing emotional dysregulation, while self-care strategies can foster a healthier self-image. Medication, too, has its place in the treatment of CPTSD. Antidepressants or mood stabilizers can help manage coexisting conditions, while certain types of medication can aid in reducing specific symptoms like nightmares or flashbacks. However, it's important to remember that medication should always be administered under the guidance of a healthcare professional. In conclusion, complex post-traumatic stress disorder is a condition born out of prolonged, repeated trauma. It affects a person's emotional regulation, sense of self, relationships, and sense of reality. But with the right treatment strategies, including trauma-focused psychotherapies, mindfulness techniques, self-care strategies, and medication, it's possible to navigate the stormy seas of CPTSD and reach the shores of recovery. Remember, understanding is the first step towards healing. By shedding light on this condition, we hope to inspire compassion, empathy, and support for those living with CPTSD. Until next time, remember, your mental health matters.